We're going to talk today about the future of health diplomacy in a post-COVID world. And with me is retired Ambassador Mark Storella, who has recently joined us here on the faculty of the Pardee School of Global Studies.
Beyond any doubt now, COVID has demonstrated that health issues are not just national security issues and health of the nation, but they're international security issues. In fact, the international community is off to rather a slow start. In many respects, international discussions have focused, I would say, excessively on a reckoning as to how all of this started and a blame game, principally between the United States and China. And one of the things that we've seen as a result of that is that the UN Security Council took 6 months to pass a resolution related to COVID. The Security Council was able to act much more quickly in the face of Ebola, which was a much more contained crisis, and actually did so in a more bold way.
What would be some of the type of steps that you would like to see?
So I think that there are going to be two big areas of focus that we have to tackle. The first is global health security itself. That's the whole question of how surveillance is done, how we prepare a response, how we ensure that resources meet the needs when they come up. Right now, there's a very strong view in the world that the international surveillance system, which is called the International Health Regulations, it's actually a global treaty with about 193 participants in the treaty, that it was inadequate, that we didn't get a warning soon enough, that we weren't able to mobilize resources quickly enough. Frankly, I think that's true. And so one of the first things we're going to have to do is the international community is going to have to strengthen these international agreements that already exist. The second big area has to do with equity of access to vaccines, to therapeutic countermeasures, to medicines and technologies. What we're seeing right now is rich countries are mobilizing quickly to throw lots of resources at development of effective vaccines and medicines. However, will poor countries have access to those vaccines? If they will, who's going to pay for it? These are very, very complicated issues. It involves mobilizing gigantic resources, as well as strengthening health systems that permit the delivery of these kinds of therapeutics and vaccines. And it's going to involve very complicated issues such as intellectual property rights. Who will own the intellectual property behind a vaccine? Will there be an opportunity for the vaccine to be manufactured beyond where the companies were that developed it in the first place? Part of what makes this particularly complicated is that the actors involved right now are not just nation states. They also include huge organizations like the Bill and Melinda Gates Foundation, which is the second largest donor after the United States to the World Health Organization, but also big pharmaceutical companies as well. So this is going to be a complex, multivariable, changeable geometry, multilateral negotiation.
If I were to put you on the spot and ask you, how would you grade the efforts of the international community up till now?
The best I can do is to say that the international community deserves an incomplete in its response. Why incomplete? It took 6 months for the UN Security Council to react to something that's killing hundreds of thousands of people around the world and causing trillions of dollars in economic damage. Incomplete because we haven't really put ourselves together to organize how we will attack these big issues before us related to health security and access to vaccines and technology. Incomplete because we know that there are resources available, but we haven't mobilized them yet. The World Health Organization has been bashed quite a bit. But frankly, I think that folks who are following closely what the mandate of the organization is, what its resources are, recognize that actually the organization has not done such a bad job at providing information to the international community, at declaring a health emergency of international concern at an early date, and at trying to organize the response as best as it can. But remember, WHO is small. It has a budget that's equal to, frankly, less than Mass General Hospital's budget, for sure, and frankly, less than most hospitals around the United States or in Europe. We're beginning to see international diplomacy attack some of the equity issues in the distribution and access to vaccines. The Global Vaccine Alliance, called Gavi, is already beginning to be engaged. It's under-resourced as well. It's unclear where it's going to go. Having said all of that, this is a grossly inadequate response to what is an enormous international challenge.
In your opinion, what might be some of the toughest challenges that might be awaiting us on the other side of COVID?
I think the resources are there for this challenge, but is the political will there? And in that, I think you have to focus on the question of the United States. There's no country in the world that has the diplomatic and technical capacity that the United States has to help mount and lead an international response. Right now, the United States has mostly been on the sidelines with an America First strategy. A lot will depend on whether or not the United States is prepared to engage fully, getting the United States to engage all of the power it has, whether it's the Centers for Disease Control and Prevention, or our diplomatic presence in places like Geneva and New York.